Hey, everybody. Welcome back to the World Health Network broadcast. As you know, my name is Ben Calderwood. We're still going to focus on access to COVID mitigations today. For those of you that have watched our recent broadcasts, you know we've been discussing legislation around right to mask, as well as a handful of jurisdictions that have attempted or are attempting to ban masking. Anyway, today we're going to shift away from the legislative arena for just a moment, focus a little bit more on access and what it takes to run a mask block. As always, if you're inclined to give this video a like or subscribe to the channel, that will be a big help to WHN. Thank you kindly for that. Now I'm really happy to introduce today's guest, Evan Sachs, who runs the Washington Heights Inwood Mask Bloc in New York City. Thank you so much for being here today, Evan.
Thank you for having me.
Okay, well, tell us a little bit about yourself, about your background, and how you got started operating the mask block.
So I have lived in New York City, specifically Upper Manhattan, for somewhere around 9 or 10 years now. 4 or 5 of that in Harlem, and now about 5 years of that in Washington Heights. And what I started to realize is last year, 2024, I was basically putting together a packet of resource information for JFREG, that's Jews for Racial and Economic Justice. I am part of the Uptown Neighborhood Group, and I was putting together a resource packet for that neighborhood group. And I realized, hey, really north of 125th Street, there aren't that many resources outside of vaccines, which of course are super important, but layered approaches are so important that I was like, hey, for people who can't afford masks, tests, especially tests these days tend to be very popular because they're so expensive. There really isn't much up here. And for those who aren't in New York City, 125th Street is probably middle of Harlem, and then Washington Heights is probably like low 160s to probably low 190s, and then Inwood is into the 200s. And of course, up here we're kind of designed by MC Escher, so it's not just the numbered streets that go north to south. We also have named streets, so it's even larger than the numbered streets would indicate. Um,
This is, if I understand correctly, this is more or less the very northern tip of the island. Is that correct?
exactly.
Okay,
Once you get to Inwood, it's pretty much you can look over the river to Marble Hill
I see.
in the Bronx, which is actually for some reason technically also Manhattan, even though it's also in the Bronx. Don't ask me why. But yeah, it's like yeah, it goes Harlem, Washington Heights, Inwood, River, Bronx,
Got
pretty
it.
much. Um, and so like these like entire 2.5 neighborhoods just, had no resources for like extra layers beyond vaccines. And so for several months I was thinking like somebody really should do something. Maybe that's me, but I'm not sure what I'd do, how I'd find the resources, etc. And then earlier this year, February 2025, somebody had posted in the Still COVID in New York City group on Facebook, basically saying, hey, HHS is doing this bulk free COVID test program because, this was the start of Trump administration 2.0. And unfortunately, the impetus was they were trying to get rid of all these tests, which sucky motivation, but hey, it benefited us, you know. And so I was like, hey, let me try this out. I'll email the email that somebody put in the comments and send them the form to be like, hey, can you send me 300 tests, which was their minimum was you had to order at least 300 tests. And sure enough, like a couple weeks later, I had a bunch of COVID tests at my door, and I was like, hey, I guess I'm doing this thing. So that's kind of how it started, and I've basically been running it out of my apartment since this past February. Um, we became a 501(c)(3) a couple months later, which I would only suggest for people who have like a lawyer friend or in their family, because even with the easy form that we were able to fill out, it gets complicated.
Sure.
Yeah, but uh, um, so we're officially a 501(c)(3) now, which has also in turn helped with, I still have to pay for a lot of the masks and tests, especially now that the HHS program has ended, but a lot of mask companies are willing to send donations of masks that are tax deductible for them because we're a 501(c)(3). The
Mhm.
pro tip, bona fide masks, they will also do donations to community organizations that are not officially 501(c)(3s.
That's good
They'll
to
just,
know.
yeah, they'll just give smaller donations to non-501(c)(3s or 501(c)(4s, etc. So they generally give, I think, about 200 masks to non-official 501(c) organizations, and they gave me 1,200. So.
So I mean, so you've been doing this somewhat by accident, though not exactly, roughly since February of this year. Do you have do you work with other people? Do you have volunteers? Do you have a staff? How does that organizationally work out?
So we're basically all volunteer right now, and we're
Sure.
a very small group of volunteers. So, you know, like I mentioned earlier, I'm lucky enough to have a lawyer in my family.
Hmm.
Namely, my dad is a retired lawyer, and he was able to help me figure out all the paperwork stuff. And, since we kind of have to have at least a couple of people on the books to count as certain kinds of organizations, he put himself on the books as a couple of positions, and me on the book as a couple of positions. So he continues to volunteer helping with paperwork stuff, which is a huge, huge help for me so that I can focus on the ground stuff. And then I currently have two on the ground volunteers, one person up in Inwood who lives really close to where the Inwood Green Market happens every Saturday. So he is able to put out a table with masks and tests every Saturday at the Inwood Green Market. Basically, they allow us to like set up a little table on the sidewalk right next to where all the official vendors are. A lot of people who aren't actually farmers do that, and it's kind of really sweet. Um, like, because the only farmers can be on the main drag there, that block, but like non-farmers are allowed to vend nearby. I have a second volunteer who started volunteering a couple weeks ago, uh, um, who basically goes down to Jackie Robinson Park on 145th Street in Harlem, and they have a seasonal farmers market that happens every Tuesday and Saturday or something like that. I may have the weekday day wrong, but she goes there every Saturday and puts out a bunch of masks and tests nearby. And so it like they have been truly superstars. My Inwood volunteer has also been helping me with reaching out to um, test manufacturers, hoping to get donations from them, which has been a lot harder than uh, um, getting donations of masks from mask companies. I'm not entirely sure why. Maybe it's the fact that tests are way more expensive, or whatever else. That's been my main guess, but I don't know. Um, but yeah, it is a lot harder to get donations of the tests than it is to get donations of the masks. And my volunteers have truly been troopers in trying to help me, find places that will do donations. Wish us luck.
So tell us a little bit about, I know we're not spending too much time talking about kind of the politics of masking in New York City right now, but just briefly, because when we prepped for this, we talked a little bit about, are you seeing individuals who are coming from other parts of New York? asking for help and assistance from your group. Do you have masks? Do you have tests? So what is the status of access in New York City generally? What is the vibe when it comes to obviously Mayor Adams previously has suggested they would attempt to ban masks in New York City. Speak a little bit about that and how that impacts your organization.
Yeah, I do see a lot of people from all over the city, different boroughs. Often I end up mailing stuff to
Mhm.
Brooklyn or, South Manhattan or Queens, wherever else, precisely because, while there are other mask blocks in the city, there is only so much capacity. Recently I ended up mailing a bunch of tests and masks to somebody who was in a desperate situation because unfortunately they currently have COVID, and pretty much every other mask block they asked was like, well, you have to come to us, and they're like, well, I really can't come to you right now, but um, so thankfully I was like, hey, I can mail them so that, you have limited exposure to other people, and uh, it's also been really difficult because at this point, a few months ago, I think it was over the summer, early fall, um, the last PCR COVID testing site in Crown Heights, Brooklyn, shut down. And certainly through my work with ACT UP, we tried to protest shutting that down because it's the last COVID clinic, free COVID clinic that
Operated through New York City's health services, is that
yeah,
correct? Okay.
exactly. Through DOHMH, which stands for
Okay.
the Department of Health and Mental Services, or Mental Hygiene. Sorry, uh, Department of Health and Mental Hygiene. Uh, um, they had a bunch of free, COVID PCR testing sites at the beginning of the pandemic, and they slowly whittled that down until we only had one in Crown Heights, Brooklyn, which was a schlep even for Brooklynites. Um, and then they kind of used the excuse of like, oh, nobody is coming to our site anymore, as an excuse to say, well, we're going to shut it down. And we tried to explain to them, hey, like, one, it's way out of the way even for other people in Brooklyn, and two, you're not advertising it. Of course, people aren't even gonna know about it and then not come. you
Sure.
know like the last week or two that they were open, they got a lot more bookings because people heard about it because of the news.
Of
And
course.
you know so yeah, that's definitely been affecting people's need for tests because they can't get free tests anymore. Certainly not free PCR tests, which are the preferred. And unfortunately, because I'm essentially like a really, really tiny 501(c)(3), and most of this is coming out of my own pocket and occasionally from donations. I can only afford to get rapid antigen tests, which aren't the best, but they're better than nothing. Um, but so for a lot of people, it's like, hey, this is at least something and it's free, so here we go.
I'm gonna jump in really quick and
Yeah.
just to clarify that PCR testing site operated by New York City's health services that you mentioned that recently closed down. That was at the time that it closed, it was the only free clinic in all of New York City. If my stats are correct, I think New York City's population is about 9 million or so.
Something like that.
So a single available site for free PCR testing, the gold standard, so to speak, in terms of COVID testing, that is now closed. One site in all of New York City. I feel I need to emphasize that. And that is now gone, of course. We'll take the time now. I was thinking about this. We on this channel, we often speak, I think, to other COVID conscious people, as you might expect. For individuals who may be looking to take precautions and perhaps haven't before, or they're just less familiar with this and our terminology, we might want to just sort of briefly define mask block, BLOC for people that are not familiar, really it's exactly what we're talking about. These are generally all small volunteer organizations that provide PPE to people who might not have access to it otherwise, community-based, small mutual aid operations. Typically, you can simply Google your city and Mask Bloc to see if there is availability in your locality where you live. It's a form of mutual aid, community aid. You mentioned ACT UP a little while ago and your involvement with ACT UP. ACT UP, of course, has been an advocacy and activism organization that's been around for an incredibly long time. Tell us a little bit about your involvement with ACT UP in New York and how that figures into activism around mask blocks in particular.
Yeah, so we are the OG chapter of ACT UP here in New York, started in the late 80s, I believe. It stands for uh, um, AIDS Coalition to Unleash Power. So, obviously, for those who aren't already familiar, it started with the AIDS crisis and still continues to be an HIV/AIDS activist organization. As you know, there are so many similarities with COVID and AIDS in terms of the activism, especially because, HIV/AIDS continues to be a problem that a lot of people don't realize is a problem and or don't realize that, yeah, we have a lot of great tools now, but they're not as great as they could be.
Mhm.
Um, and a lot of the connection there in terms of the Venn diagram where the two things overlap is that, of course, HIV/AIDS is an immune condition. And so ACT UP is one of the few organizations I know of, at least, that I've been involved in that still requires masking for in-person indoor events, which is very important both for me generally and also we want to protect our HIV positive brothers and sisters.
Is that universal throughout their chapters or just in New York? Do we know?
Unfortunately, it's not universal throughout the chapters. It's definitely the case here in New York. I
Okay.
know I have friends in other states who have struggled a bit with getting their chapter to require masking, unfortunately. And, unfortunately, as with any group, AIDS activists and queer activists are a multitude and have many different opinions. And I've seen other AIDS activists who are not part of ACT UP New York who get very upset when I advocate for masking, and it baffles me because aren't you trying to protect people who are extra vulnerable to the bad consequences? I don't get it, but it's there. Um, but yeah, so a lot of what ACT UP New York specifically has been doing has been, fighting against mask bans from Eric Adams's attempt to make New York City specific bans to Governor Hochul attempting to slide stuff into the New York State budget, which she unfortunately was semi-successful at, but also at the same time, thankfully, was only able to get something very watered down in there. So it's in some senses a win, as in some senses a loss. It's complicated. So yeah, like that's been one of our efforts. We did a postcarding campaign that is currently a bit on hiatus because all of us who were working on that postcarding campaign are dealing with a lot health-wise and otherwise, and we just are low spoons right now. But yeah, so we're also hoping at some point to get masks in care packages to inmates at an upstate prison because, HIV/AIDS is a big problem in prisons. It just generally high population of HIV positive folks, unfortunately. So hopefully we can manage that at some point to, help folks who are immunocompromised protect themselves in a really sucky situation. Um, and yeah, we've also talked to DOHMH about hopefully trying to at least like do occasional like, hey, if you're not doing this, we're happy to set up in lobbies of your other clinics to give out PPE and
Mhm.
COVID tests and stuff to people who want them for free. Of course, we don't have the funds to do proper PCR testing, but at least we could give them rapid antigen tests, you know.
So, speak just a little bit about, you've obviously alluded to a number of reasons in our conversation so far, but why masking matters to you personally, why access to masks and PPE and testing matters, and sort of what drove you to participate in groups like ACT UP and JFERGJ. Did I say that right? I hope.
Hey, JFREJ.
JFREJ. Now
It,
I've got it right. Thank you.
yeah,
Okay.
it's confusing. Yeah, we just say JFREJ for
J
easy.
Fredge. Okay.
Yeah,
Noted.
yeah, it stands for Jews for Racial and Economic Justice, which is a mouthful to say on its own, but uh, um, yeah, like certainly at the very beginning of the pandemic, I was had a very steep learning curve, was learning a lot from my then roommates,
See.
from my long distance boyfriend and his mom, who's a nurse, and uh, yada yada. But like the more I learned, the more I was like, oh shoot, like got to make sure I'm doing this right, both to protect, people like my boyfriend who's immunocompromised and to protect myself because I've got immune conditions too, even though they're a lot more mild, and that kind of, evolved from there on the like selfish protecting me and family and friends level to wait a second, we're all vulnerable, just because, like, even if I was otherwise like young and healthy, if I was, 20 years old and had no other comorbidities whatsoever, like, hey, I could still, get a case that results in long COVID, or, it just kind of sucks to be sick in general, Why would I want to expose myself to that more than I need to? And why didn't I start this earlier,
Yep.
Um, so, and also, like goodness knows you can be asymptomatic or pre-symptomatic, and that's when a lot of transmission happens. Like we've known even before COVID that like a lot of illness, the primary window of transmission happens in the few days before you're showing
Symptoms
symptoms.
manifest.
You don't know that you're sick at that point. It's Schrodinger's illness. Um, and so, like, hey, even if I'm feeling just fine and dandy on a given day, I don't know everything that's going on in my body. And, like, goodness knows, like, even if I never get symptoms, like, I could end up accidentally passing something off to somebody who gets it way worse. Even if I don't know the person from Adam, uh, you know, why do they deserve that?
It's we find ourselves in a position here in the end of 2025 having to remind ourselves and each other that caring about other people is probably advisable. Um, it is always a little bit surreal to still be having that discussion as if it's unlikely or as if it's something that somebody should consider and then maybe say maybe not. Anyway, I digress. But yeah, that note about, asymptomatic and pre-symptomatic transmission in particular, I think thank you for saying that. I think that's very important. It's something that we knew about really early on in the pandemic, as you mentioned, as it pertains to COVID in particular. And when that news does occasionally surface now, it's always reported on as if it's a new piece of knowledge, which is interesting. Our pandemic memories seem to be very short. Um, from your position, having operated your mask block now for 8, 10 months or so since February of 2025, I, what do you what are your concerns about, access to PPE, access to, COVID precautionary resources in general?
Yeah, so for me, number one is really people being able to afford this stuff. I like a lot of people, even if they do actually legitimately want and understand the need to do this stuff, especially in my area, like there's so much need, financial and otherwise.
Mhm.
Um, like I have been told multiple times at this point, like, oh, the fact that you're doing this has allowed me to take my kids to see their granddad for at least one last time and stuff like that. And like, there have been like handoffs where I like come back to my apartment and end up crying because like, oh my
Mm.
God, like, you know, um, eh, yeah, but just so many people, even if they know their ish, uh, they can't afford it on their own, and or like if they can afford anything, it's only baggy blues, those surgical masks
Sure.
that are super leaky. And so the fact that I am able to enable people to care for their loved ones, visit their loved ones, etc., uh, just is so amazing to me. Or even just like people who are like, hey, I want to take care of my community in general, but I can't afford it otherwise. That's amazing to me. Uh, um, you know, Another issue is also just general education. There's so much misinformation out there these days that a lot of people don't even know that, like, hey, A, we're still in a pandemic. B, like, vaccines are both helpful and not magic bullets. Like they often you get one extreme or the other, which drives me banana pants. Um, and or like you get people who one of my friends who actually took care of one of my cats when she was still on the street. uh, um he you know believes a lot of misinformation about vaccines and also believes that like masks are harmful for you, like you're
Mhm.
breathing in your own air or something. I would be lying if I said I totally understood the misinformation around that, but there is a lot of misinformation out there where like no, actually, if you wear a good, high quality, well made mask, it is very breathable, it does not harm you, and it actually protects both you and the people around you, much the same way that, driving on the correct side of the road protects both you and the other drivers on the road.
Or stoplights, for example, to use the driving metaphor that you just introduced. They exist for a reason, to protect all drivers on the road. Anyway, please continue.
Yeah, no, completely agreed. But so there is a lot of like misinformation ranging from like very simple, initially innocuous seeming, like, COVID is just like the flu, we're not in a
Sure.
pandemic anymore, which the COVID is just like the flu thing drives me banana pants because even if that was true, like that's a lesson in maybe we should be taking the flu more seriously because it also kills people. But so anything from the bare basics that I do blame a lot of governments for downplaying this stuff to this belief that certain PPE or other preventative measures are dangerous in some way when they aren't, and certainly, the fact that so few governments are investing in track and trace anymore. uh, and right now we're in shutdown, so we're seeing even less information on that front is not helping with that. So there's
It's
a,
worth reiterating. I
yeah.
shouldn't have interrupted you. I
Oh, go for it,
apologize.
please.
In moments like this, when we're talking about the failures of governments and the failures of institutions, that operations like yours, operations like WHN for that matter, again, all volunteer organizations of people who are spending their own spoons, their own time, their own money in many instances. The only reason that those operations exist is precisely because the institutions that are supposed to be doing this work have deliberately made a choice not to. We are filling enormous gaps in health institutions, healthcare, health policy, et cetera, et cetera, et cetera. And I think sometimes now that we're in the sixth year of a pandemic, we overlook the sort of core socio-political driver of discussions like this. Just
Mhm.
important to reiterate. Um, so
Yeah, and like this stuff is like so important to me in part because to what you were saying earlier about mask bans and mask rights and all that is that like it's so important to say like, hey, you're allowed to do this stuff. You should be allowed to wear your seatbelt in the car and
of
you should be
course.
allowed to follow the speed limit, but also it's not enough to say you have the right to do so if people aren't doing it, we've seen since, requirements started getting lifted a couple years ago, 2, 3 years ago at this point, you know, just because people can don't mean they will if they're not required, and much like, following driving rules, there are certain things where it's like, hey, you need to do this in order to prevent both yourself and others from getting injured. You don't go up to somebody wearing a seatbelt and say, "Hey, have you recently got in a car accident? Is that why you're wearing a seatbelt?" No, you're wearing a seatbelt so that if you do get in a car accident, you and or other people won't get as badly hurt,
Probably worth pointing out that seatbelt laws exist in pretty much every jurisdiction in the United States, and by and large, people don't seem to object to that. Although they did, I hasten to add back in. I want to say this was around like the earlier mid '80s when they started to be implemented. There was friction around those, but we got over it and we moved on because we realized it was for the universal good. So, again, we do have a lot of institutional and social comparisons for this sort of action. And they're so familiar to us. Seatbelt use and seatbelt laws is a great example that we kind of forget that there was a logic and a thinking to society adapting to these things that we could do with something like COVID and COVID precautions, but of course, as we've just been discussing, we have largely abandoned so far. Uh, uh, um, we've addressed this topic already to a great extent, but as we sort of cruise towards the end of our chat, speaking a little bit more generally, in your community in New York City, what 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 are the needs in terms of public health advocacy, in terms of policy that you see, especially as you guys are heading towards a mayoral election very soon? Um, Reflect a little bit on that from your point of view again as being the operator of a local mask block.
Yeah, a lot of it is access to affordable resources, as we mentioned,
Sure.
like even knowing where to look can be a struggle for a lot of people. And then once they find something, often it's wildly expensive,
Mhm.
especially from the testing end, which is, for better or for worse, why, I tend to run out of tests so fast oftentimes. But, um, yeah, yeah, it's a lot of it is accessing and affording the resources that people need. A lot of it is, can they travel to the place, which is why I find it so important to offer delivery and mail services. I generally tend to deliver from 125th Street upward. I figure that even if I end up needing to take the subway to somebody to make a delivery, at least I'm taking on that health risk in terms of exposure rather than them. Um, and a lot of it is also education, knowing that like A, we're still in the pandemic, B, you know, masks can protect you from other airborne illnesses as well, from the flu to RSV to we recently had a Legionnaires outbreak in Harlem, and you know while those start in water coolers, the Legionella bacteria, starts growing in the water cooler. Most people aren't bathing in the water coolers. They get infected once the water turns into mist and becomes airborne.
Mm.
Um, so it protects you like both indoors and outdoors. It protects you against a wide variety of airborne illnesses, even if you don't think we're in a pandemic, which we are. Um, and goodness knows, knowing that like better masks exist than those black baggy blues is the barrier for some people. And I've had tons of people tell me, "Oh my God, these kind of KN95s are so comfortable. I didn't know masks would be comfortable." That's a big barrier. Uh,
Interesting.
um, and yeah, and then also, you know, not just saying you're allowed, but in some cases, we have unfortunately rules for a reason because, unfortunately, even if we say you can, but you don't have to, that's not enough of an impetus for a lot of people, even if it's a case of, hey, you could be harming both yourself and others if you don't do this.
Uh, I, Evan Sachs, thank you so much for coming on the broadcast today and talking about your work in New York in New York City. For folks who are in New York City, if you want to learn more about your mask block, do you want to give your website so they can find you online? I know the URL is a little bit complicated. We will for our viewers, we will put it in the description of this video, but do you want to tell us a little bit more about where people can find you online?
Sure thing. You can find the Mask Bloc's Facebook page, Washington Heights Inwood Mask Bloc on Facebook, wahai.inwood mask block on Instagram. Our website is uh, bit.ly/whiny mask block. That's WHINY mask block for Washington Heights, Inwood, New York. Had fun with the acronym on that one. Um,
And we
but
will we just again we will get those links in our video description, so it will make it easy for people who want to check you out. So,
thank you so much.
all right. I thanks again, Evan, for having this chat with us today. A little bit about us at WHN. We, of course, are the World Health Network, a global organization working to end the COVID pandemic as a global health threat. And as you can see from this conversation today, reckoning with, sort of other public health challenges here in 2025, which is now almost coming to an end. So 2025 and beyond. Please check us out online at whn.global. We really hope you'll visit the website, maybe consider volunteering and, doing joining us in some of our work. So thank you so much, everybody. We'll see you in the next broadcast. Bye bye.